65-year-old woman referred from a local GP for weight gain and facial swelling for the past 4 months. Also complains of generalized lethargy, fatigue, depressed, have polyuria, polydipsia for the past 2 months, and she also has difficulty in climbing stairs. She was active in sports but had injured her left knee while playing badminton 2 years ago. So since then, she has been dependent on traditional medicine for the pain, for the knee pain. Okay. So physical examination reveals moon-like faces with buffalo hump, truncal obesity, BP was high. Okay. Pulse rate, respiratory are normal. Okay, not significant. Respiratory, okay. Abdominal examination reveals purple striae. Okay, and there is presence of proximal myopathy of both arms and legs. Other examinations of other systems are unremarkable. Okay, so this typical presentation. In your notes, there's already the answer there, kan? Okay, so these are the typical presentations of Cushing syndrome. Okay, moon-like face, obesity, facial swelling, buffalo hump is high. Okay, so in the patient what do you think is probably the cause of his Cushing's from the history? I mean, of course, you will need to investigate, but what is the significant
cortisol?
Increase in cortisol due to
Traditional medicine.
Yeah, because we put up this case because it is quite common. It is quite common nowadays with the usage of unprescribed medicine, which a lot is actually steroid based. Yeah, so this is quite a common scenario which you might find when you practice. Okay, a patient who came with moon face, Cushing-like faces, and if you dig in the history, you will find that this patient has been on traditional medicine. So of course, usually patients don't reveal this history if you don't ask. You know. So this is, I would say, quite a common scenario that you might see. Although we are not going to discuss so much about this because we are going to discuss more about adrenal, but having adrenal tumor itself as the cause of Cushing syndrome is quite rare, you know. So this is give you some exposure of what you might encounter in a real practice, you know. Not to forget about traditional medicine, and even patient on steroid, they can develop. If patient on steroid, you can actually easily get the history. Okay, patient, because you usually would ask a history of medication, and patient would say, okay, I am this medication. So it's understood when the patient comes with this presentation. But the problem is when this patient having some kind of over-the-counter medication, they don't consider that as medication sometimes, you know, so you will miss that out. Okay, so these are the typical presentation. They have purple striation, moonlight faces. So investigation